Welcome to Modern Group of Institution. Today in Pharmacology Second BP 503E, we study about the drug used in congestive heart failure other than cardiac glycosides. The contents of today's topics are selective beta-1 adrenergic agonist, phosphatidylserine esterase 3 PD3 inhibitors, angiotensin converting enzyme inhibitors, diuretics, vasodilators. Now, first of all, selective beta-1 adrenergic agonist. As we all know, all the adrenergic agonist drug increase the rate of contraction of cardiac muscle. So, dobutamine at doses equal to or less than 5 μg per kg per minute has a selective beta-1 adrenergic agonistic activity. Beneficial effect in emergency treatment of acute congestive heart failure and MI includes the following. It increases the cardiac output as a result of enhanced contractibility without increasing the heart rate. Reduction of mean arterial blood pressure, lowering of total peripheral vascular resistance and consequently decrease the afterload. And it also caused reduction of ventricular filling pressure. How it acts? Basically, by the help of sympathetic nerve, beta adrenergic agonist bind on beta 1 receptor and beta 2 receptor. And on beta 1 and beta 2, what happen when this selective beta 1 adrenergic agonist bind? It stimulates the GS subtype of GPCR, which turn increase the production of adenyl cyclase. Adenyl cyclase, adenyl cyclase stimulate second messenger, that is cyclic AMP, and cause contraction. And adenyl cyclase is stimulated with the help of ATP. When ATP is converted into CAMP, cyclic adenosine monophosphate. Another is it also produce PDE3, phosphatidylserine 3. That is another mechanism how selective beta-1 agonists help in the contraction of the cardiac muscles. Now, phosphatidylserine third, that is PD3 inhibitor, how it works? When non-epinephrine and epinephrine bind on the beta-1 and beta-2 receptor, it stimulates the GS type of GPCR, which in turn stimulate the adenyl cyclase in the presence of ATP. This ATP convert into the cyclic AMP and contraction of the smooth muscle, that is the cardiac muscles. Now, this cyclic AMP again convert into the AMP with the help of PDE3, phosphodiesterase 3. This PDE3 inhibitor inhibit the conversion of cyclic AMP. As the concentration of the cyclic AMP increases, the contraction of the cardiac muscle remain increases. This we can say increase in the intracellular cyclic AMP, activation of the protein kinase A, calcium entry through L-type calcium channel, inhibition of calcium accumulation by sarcoplasmic reticulum, contractility increase, cardiac output increase, and peripheral vascular resistance decreases. Now, how it works as we discussed in the diagram. Inhibition of the myocardial phosphatidylserine 3, the enzyme responsible for cyclic AMP degradation. The cyclic AMP is degraded into the AMP. The result in the positive inotropism via cyclic AMP PAC cascade in the similar way to the selective beta-1 adrenergic agonist. Agent in this class include the examples, that is amioron and milrinone. PD3 inhibitors are suitable only for acute congestive heart failure because they can induce life-threatening arrhythmia on chronic use. Now, coming next to the angiotensin converting enzyme inhibitors. Angiotensin converting enzyme inhibitor, what are they? First of all, we will understand how angiotensin is formed. Basically, angiotensinogen, it is one of the uh, polypeptide which is present in our blood vessel. The kidney release the renin, and renin is converted. Renin convert the angiotensinogen into angiotensin 1, and angiotensin 1 is converted into angiotensin 2 with the help of angiotensin converting enzyme. Angiotensin 2, what it do? It increase the aldosterone, it increase the sodium reabsorption, it increase the blood volume, it increase the cardiac output and blood pressure. It is an potent vasoconstrictor. But when angiotensin converting enzyme inhibitor are given, they inhibit the conversion of angiotensin first, inhibit the conversion of angiotensin first into angiotensin second, which lead to decrease in the aldosterone, decrease in the sodium reabsorption, decrease in the blood volume, decrease in the cardiac output, and decrease in the blood pressure. So, how the use of angiotensin converting enzyme produce the following action: reduce the sympathetic nervous system tone, increase the vasodilator tone of the vascular smooth muscle, and hence total vascular resistance fall promptly. Decrease circulating angiotensin 2, increase bradykinin, decrease catecholamines, reduce sodium and water retention. As a result of reduced angiotensin induced reduced aldosterone secretion. As the aldosterone secretion decreases, the sympathetic nervous system effect decreases. Ultimately, both preload and afterload are reduced. Clinical trial also showed that the use of angiotensin converting enzyme in congestive heart failure has significant reduced morbidity and mortality. Now, other drugs which used in the congestive heart failure without inotropic effect. अभी तक हमने जितनी भी ड्रग पढ़ी, जैसे कि कार्डियोग्लाइकोसाइड, जैसे कि हमने पढ़ी एंजियोटेंसिन कन्वर्टिंग एंजाइम इनहिबिटर्स, जैसे कि हमने पढ़ी सेलेक्टिव बीटा 1 एगोनिस्ट, जैसे कि फॉस्फेटिडिएस्ट्रेज. Third, they all are inotropic, giving inotropic effect. But the drug used in the congestive heart failure without having inotropic effect are, first is diuretic. Diuretic क्या करते हैं? Reduce करते हैं cardiac preload by inhibiting sodium and water retention. Cardiac pumping को improve करते हैं, जिसके कारण से reduction in the venous pressure, relieving edema. जैसे कि thiazide, hydrochloride, thiazide and loop diuretic, ये यूज रेगुलरली यूज किए जाते हैं इन कॉम्बिनेशन विद डिजिटालिस. पोटेशियम स्पेरिंग डाययूरेटिक्स भी कभी कभी यूज किए जाते हैं टू करेक्ट द हाइपोकैलेमिया दैट इज एन एडवर्स इफेक्ट ऑफ कार्डियक ग्लाइकोसाइड्स. स्पाइरोनोलैक्टोन प्लस डिजिटालिस प्लस एसिटाइल कोएंजाइम एंजियोटेंसिन कन्वर्टिंग एंजाइम inhibitor clinical trial shows that improval survival of myocardial patient. Now last, that is vasodilator. Direct vasodilator are also used in the congestive heart failure, just like arteriolar dilator. Example is hydralazine. Venodilator, reduce preload like organic nitrate, nitroglycerin. Arteriolar and venular dilator reduce both preload and afterload like angiotensin converting enzyme inhibitor, sodium nitroprusside alpha 1 antagonist, and calcium channel blockers. Thank you very much.